Well, we're going to jump into this, and as others join us, we'll bring them on board. This is a brand new experience for us to open up our meeting concept to those who are not members of our mastermind groups. As many of you know, a big part of what I do is operate for home care CEO mastermind groups for owners of independent companies across the country. We have 4 groups, we have 42 companies, and we meet like this regularly. But with all of the things going on with the coronavirus and the inquiries we've been getting, I thought it would be interesting and useful to open up what I'm calling office hours with Stephen Tweed. And basically the format will be to pick a topic, share a little bit of information about what's going on, and then open it to questions and discussions, recognizing that we sent a pretty broad invitation and didn't know exactly who would choose to participate, and that we might have competitors in local markets and we might have people from different organizations, but that because all of us are interested in the home care business and interested in what's going on in our current situation, that it would be worth having a conversation. So we have a relatively small group this time, and I think that's good for the first time that we're doing this. And so I'm going to deviate just a tiny bit from my original agenda in that I was going to start off with a couple of highlights and then open it for questions. But since we have a small group, let's do a quick go around the room and give each of you a minute to tell us who you are, your company, where you're located, the size of your company, and then we'll at least have a sense of who's on the line, and that'll help us going forward. So I'm just going to go around the top of my screen and call on folks and give you an opportunity to introduce yourselves. So let me start with Kristen, who's with the Home Care Association of Florida. Tell us a little bit about you and what you're doing with your private duty members.
Sure, thanks, Stephen. So yeah, I'm Kristen Wheeler. I'm with the Home Care Association of Florida. I am their Director of Private Duty Services. The Florida Association is one of the only in the country, to my knowledge, that has a fully separate membership specific to private duty companies. So I am a former home health agency owner myself. I used to have an agency down in Monroe County, the Florida Keys, once upon a time. So I know the challenges of private duty agency ownership. And of course, in a time like this, when there's a crisis, people turn to their association, which is great. I think it's the best reason for us to be in existence. So I'm just very interested in hearing from, those of you on the ground that are in it right now and what challenges you're facing, et cetera, et cetera. So very grateful, Stephen, for letting me tag on here and just be part of this. I appreciate it.
Well, we're glad you're here, Kristen. Thank you for being here. We're going to go out to Hazleton, Pennsylvania, and Marlon Duncan. Markin, tell us a little bit about you and your company and what's going on in Pennsylvania.
All right, I'm going to get it off of unmute there. Yes, I'm Marlon Duncan. I'm from Hazleton, Pennsylvania. Currently, we have 12 offices and 12 Comfort Keepers franchises, actually 9 with 12 offices in the Pennsylvania. So we're right in the center of everything that you guys are in with going on with the coronavirus. We've been very, very fortunate where we are. We do have one client that's currently going through the virus. And as it happens, fortunately for us, it was a family caregiver who was living at the home. So we ended up getting a caregiver client quarantined together, and she's taking care. So she gets to continue. We have, obviously, I think our challenges are going to be ahead of us. We just heard that our Office of Long-Term Living, which runs all of our Medicaid waiver, we just found out that they're closed. They closed at the end of March, and we just found out about it today with no notification. So we're going to have some challenges to deal with that. So that's where we are right now.
Okay, good. Thanks, Marlon. Welcome. Let's go down to Matt in near Orlando, Florida.
Good afternoon, everyone. I am a Comfort Keeper owner as well. Marlon and I go way back, and I have 2 offices in Central Florida, Orlando area, and also Daytona Beach. We actually we're 100% private, so we don't have any of the Medicaid waiver issues that Marlon's talking about with the closed offices. But you know, we're doing okay. I'm waiting for the other shoe to drop. You know, I'm pinching myself every day that we're still plugging along pretty well. And so here's hoping it, at least for, you know, all of us, that we all keep going. So just interested in, you know, how everybody else is doing.
Okay, good. Thanks, Matt. Welcome. We're going to go across the pond to Cornwall, England, and my friend Neil Eastwood. Neil and I go way back as providers of an online assessment tool for the selection of caregivers. Neil's got some exciting new things he's working on, and so we were talking the other day, and we invited him to just join in to hear and listen and share. So Neil, tell everybody a little bit about what you're doing.
Yeah, thanks. Thanks, Stephen. I was a home care provider myself. We're a NASDAQ listed entity, but entirely operating in the UK with 10,000 staff. That's about 12 years ago. And since then, I've spent my time looking at the recruitment and retention of care staff, and I've worked with Stephen extensively over the years on that. Very recently, however, given the COVID-19 impact, we did a survey, a national survey, which we got the results of today across the UK to understand, with a good representation from home care, to understand the impact on staffing right now and what actions people are proposing or are thinking of taking to try and speed up the recruitment process, to manage social distancing in recruitment, and whether they're going to take on volunteers or temporary staff. So I'm not going to take everyone's time up, but if you're interested to talk a little bit more about the impact over here, and I'm sure it will be very similar with what you have over there, then very happy to talk a bit more about that, and fascinated to hear how everyone is managing over in the US.
And Neil has promised to share some of his data with us, and we'll do some articles and share some of that here in the US. So thanks for being with us, Neil. Mark McDermott, tell everybody a little bit about you and where you're located.
Hi everyone, I'm Mark, and I have 3 Touching Hearts franchises in upstate and central New York. We provide companion care only, so we have no home health aides and we don't do personal care. In total, we have about roughly 200 employees. Actually, we've lost, in terms of number of clients and number of caregivers, we've lost about 10 to 15%. But we've actually increased hours slightly because the cases that we are getting involve longer hours, and the clients we lost are the smaller clients who, you know, a lot of what we did was as much convenience as it was need. So I'm also to some degree waiting for the other shoe to drop, but I'm not sure that it will. In New York, we're facing the next 2 weeks is really the crisis period, the peak of this virus. And my main focus right now is retaining our caregivers and hoping that the fear of the virus doesn't result in too many people leaving.
Okay, well, welcome, Mark. Glad we're here. I'm going to stay within the Touching Hearts family, and we've got Don Franks and Don Franks, actually Andy, 2 folks from Don's organization. I don't know who wants to go first. Don?
Yeah, this is Andy. I'll go.
Oh, okay.
So I'm the
CEO.
Yeah, I'm sorry. I'm the CEO and founder of Home Care Professionals. Don's been working with me for about 2 years now. He's our president. Together we run the company. We are about 70% private pay. We're also a VA contractor, so about 25 to 30% of our business is through the VA. And you know, we're in the San Francisco Bay Area. We have 3, well, we just opened our 4th location, but really 3 functioning mature locations. And we have a census of about 170 clients. You know, being one of their first areas with, you know, a significant amount of COVID cases, we've definitely seen it impact our business. We're down about 10 to 15% just from a census and revenue standpoint. But it sort of was a sudden reaction we saw when the shelter in places first came out, and it's definitely stabilized since, although we're still seeing not a whole lot of referrals coming out of our acute, you know, setting referral sources. So, Dawn, anything you want to add to that?
No, I think that sums it up.
Okay. Well, welcome, guys. Thanks for being here. Let's pop back across to the East Coast in New Jersey. Andrew Dubler, tell us, everybody, a little bit about you.
It's nice to be here. Andrew Dubler with Home to Stay, a private pay agency. 100% of what we do is private pay. You know, just under 3 million we do. And again, that's all private pay, no entitlement work, no VA. VA stiffed us on about $10,000, so we didn't go back to them. And, you know, we probably had about a 15 to 20% contraction since the quarantine started. To the gentleman's point, I think it was Don that spoke, the ones that could hit the pause button initially seems that they did. A couple cases that were going to start kind of hit the pause button. And it's been pretty quiet here. We're just kind of in a big waiting mode. We're a suburb of Philadelphia in South Jersey, and we're just all kind of holding our breath and waiting.
Well, welcome, Andrew. Thanks. Glad you're here. Let's go up to North Jersey. We've got Lou Romano and Laura Coyle from Homewell Senior Care. Lou and Laura, are you on there? You're muted. You'll need to unmute. Lou, are you there? Maybe not. Okay.
I'll try to unmute them. Hold on. Oh, Laura came on.
Oh, there's Laura.
Hi,
Okay.
Laura.
There we go.
Here. How you doing?
Hi, Laura. Good to hear from you. Glad you're with us. Tell everybody a little bit about your organization there.
So we are in Hackensack, New Jersey. We've got 2 locations, one in Hackensack, which is our main office, and then we recently moved our second location to Union. So we do approximately like 10,000 to 11,000 hours of service per week. We have been working remotely for the last 2 weeks. So far, knock on wood, it's going well, but we are definitely losing clients. I don't know the percentage. I know we're in the midst of getting those numbers together. We have a lot.
Can you guys hear me?
Yeah, we can hear you.
Yeah, go ahead, Lou.
Oh, I'm sorry.
Hey, it's all right.
Laura, you're doing great. It looks like the percentage is about 10%. You know, it just started this week, really dropping.
Okay, go ahead, Laura. Finish up what you were saying.
Yeah, no, that was pretty much it. Like a lot of people putting us on pause. That I'm, you know, pretty confident we'll come back on service, but you know, just like everyone else, they're just not comfortable having anyone in the home. So, you know, temporary, but I think we'll be back on track.
Okay. And Julie Taylor is with us. Hi, Julie. Can you hear us? You'll have to unmute.
I can hear you. Can you hear me now?
Yes, go right ahead.
Hi, thanks for having me today. I am with Alliance Home Healthcare Services, and we are a private duty agency in Southwest Michigan. And we have 7 branch locations. We're privately owned, and we employ over 450 staff members. What we've seen in Michigan is right now an influx of course, the COVID cases. Detroit, we just listened today to the governor, and Detroit should be peaking probably in a couple weeks. And we are probably a couple weeks behind that on the other side of the state. So we've been very lucky. We're all of our caregivers have been phenomenal. We haven't lost very many. We've lost a few to the fact of them having to stay home and take care of their children and not being able to have home care or not being able to have child care for their children. We have put some of our clients on pause ourselves just so we can manage our priority 1 clients. I think the big thing for us is really looking at the priority clients and making sure they're cared for first, and not worrying as much about the housekeeping measures that we usually do. So we know most of those people will be back as soon as this is all over. It's just, you know, we are taking a stand that the priority clients are first people that we serve. So we're doing really well, but we are bracing ourselves because Detroit, we know the state of Michigan is right behind New York.
Yeah, yeah, okay. Well, welcome, Julie. Glad you're with us and glad everyone is here. What I'm going to do is share my screen and just pop up a couple of slides to summarize what we've been seeing and hearing and learning. Jill, did that come up okay?
It did.
All right, very good, thank you. So how are home care companies coping with COVID-19? And as I mentioned, the last week we've been meeting with our home care CEO mastermind groups and also talking with some of our individual clients. And if I were to summarize how companies are coping, I would sort of put it into 4 categories. The first one, most important one, is protecting clients and caregivers. And that really started with communication. Agencies writing letters, sending emails, doing other things. Several have done videos. Marlon Duncan, who's with us, shared a wonderful thank you video that he shot and sent out to his caregivers and office team, thanking them for sticking in with him. And so the things that we're doing, setting policies around screening caregivers each day before they go into a case. And I just saw an article where the EEOC has eased its restrictions on asking employees health-related questions. And that's around the Americans with Disability Act. You couldn't ask employees about health-related issues, but now you can screen your caregivers by having a quick set of questions and asking them to take their temperature before they go into a client's home. Also, we've seen a couple of agencies that have shifted their scheduling around. So there's one caregiver, one client, and each caregiver has only one client. Each client has only one caregiver, or if there are multiple shifts, maybe 2 caregivers, but instead of having clients moving around from client to client. So some of those kinds of activities. We had one of our members that basically eliminated those cases with very short shifts because they were having difficulty staffing them, and where the client didn't have a critical need, to focus their resources on those clients that had longer shifts and more needs, and making sure that they could cover those cases. We've seen some members who have stopped taking new clients at all to focus on their current clients. We've had others who have set some specific criteria for accepting new clients. One said that we're only going to take clients if it's 8 hours or more per shift. We had one member that said they were only taking live-in clients. So companies have done different things to help protect their clients and their caregivers. The other big challenge that agencies are experiencing is the shortage of personal protective equipment, masks, gloves, shields, coverings. The word escaped me, apologize. So companies are doing different things to find sources, particularly of masks and gloves. And some of our members are working together almost like a purchasing group to find sources of supply and provide those. One of our members had a relationship with a local company that manufactured boating cushions and had fabric, and so they converted to sewing masks. Another company had a similar business that was able to do sewing and was able to make masks. So there are a lot of innovative things going on with regard to acquiring personal protective equipment and helping to protect clients and caregivers. I think pretty much by this time, everyone is familiar with operating remotely, and thanks to technology, we're able to do that relatively easily. We found that some companies were ahead of the curve because they were already set up with multiple offices using voice over internet protocol phone systems. And of course, laptops and the internet has really enabled us to do that, having access to their scheduling software. And one of the things that's coming out of operating remotely, and I saw this on one of the news programs interviewing the CEO of a large company and saying, this is going to cause us to really rethink our need for office space. And, you know, we have individual cubicles with each employee having their own space. The fact that we're operating remotely for this long period of time is really going to cause us to rethink how we use office space, which I thought was quite interesting. And of course, the other big thing is recruiting, interviewing, and onboarding remotely. Many of our members are continuing to recruit rather aggressively. They're doing their interviewing by video. And again, because a number of them were accustomed to using this Zoom platform, they were able to continue doing that. They're also doing onboarding training using Zoom video. Some others are continuing to do face-to-face training, limiting the numbers of people, putting them in big rooms and with lots of social distancing going on. The biggest fear that members have with regard to onboarding remotely is not being able to do the skills test. And even when they bring applicants into a room and keep them spread out, they're not comfortable doing the skills tests like transferring and those kinds of things that require physical contact. So there's some notices now about new employees, members, limited their new employees to certified nursing assistants, CNAs with 2 years of experience, who were demonstrated up these skills. Some other folks have done things like that. So these are some innovative things that companies are doing with this. In a moment, we'll come around and get each of you to tell us a little bit about how you're going and what's working and one another. The other thing I wanted to highlight today, we'll touch on this. We won't dig too deeply because we're still gathering information, are the 3 new federal laws that passed during the month of March. The 3 laws were the Coronavirus Preparedness and Response Supplemental Appropriations Act, which passed on March the 6th. Sorry, I got myself.
Stephen, Dad, I think you're getting a little choppy when you're changing the slides.
Okay.
You know, that happens once in a while.
Okay.
So
Thank you.
Sometimes just give it a second when you switch it, and then it catches up. So.
Okay. Is the audio better now, Jill?
Yep, that's better.
Okay. Thank you.
Yep.
The Families First Coronavirus Response Act passed on March the 18th, and then the Coronavirus Aid, Relief, and Security Act, CARES, which is the one we've been hearing all about. We're still learning about these laws. The first one is mostly a fundamental supplemental appropriations bill, so it provides some money. We have a brief summary of where some of those dollars are going, and while this will fund things like the Public Health and Social Services Emergency Fund, the Disease Centers for Disease Control and Prevention, the National Institutes of Allergy and Infectious Diseases. These are funds going to existing agencies and will not have as direct effect on home care. The second law is the one that's going to have the biggest impact on us which is the Family First Coronavirus Response Act, passed on March the 18th. And it's divided up into these divisions, A, B, C, D, E, F, G, and each of them contains specific requirements and resources. The biggest impact is going to be the Emergency Family and Medical Leave Expansion Act, that's Division C, and it will require companies to pay for emergency family and medical leave. We're still sorting that out, but it appears as though healthcare organizations are exempt from that requirement. And we just learned that home care is considered a healthcare provider under the law, and that we will be exempt from that. We're still looking for final details as to whether or not that's true and what the implications of that will be. Another provision of this law that will have an impact on us is the Emergency Unemployment Insurance and Stabilization part of the bill, which provides enhanced unemployment benefits. And several people have done the math and have figured out that if caregivers take this unemployment, they'll make more money staying at home than they will working, and that could be a serious problem. And the emergency paid sick leave may also be a challenge. And so there are some provisions in there that we're going to be looking at more closely and digging into. If any of you have dug into that, have some insights, we'd be happy to have you share them. And then the third bill is the CARES Act. And as you know, it's 1,000 pages and $2.2 trillion. So there's a lot in here. But the highlight pieces of this are the testing for COVID, the federally backed loans for small businesses, the loan guarantees for distressed business that are not covered above, the expanded unemployment insurance for self-employed and independent contractors, and then the rebate of $1,200 per adult and $500 per child for those with adjusted gross income of up to $75,000. So those are some of the highlights we're working on and looking at, and we're going to pause for a moment and take your questions. As we go forward, our plan is to continue with office hours every Thursday at 4 p.m. And so if you have topics or questions, we invite you to send me an email, Stephen@leadinghomecare.com, and we will put together an agenda each week, try to get that out ahead of time to you. So those are some of the highlights of the things that we're looking at, what we're seeing. What questions does that raise for you, or what comments do you have that may be of interest to the others on the call?
I can go. Andrew with Home to Stay, and I can tell you I spent a tremendous amount of time last week becoming very familiar with the Families First Act. You know, it was Greek to me at first, and worked with it very closely, and by the end of the week was much more comfortable and gearing up to implement it. But then, you know, the Home Care Association and that ruling that you referenced, that they looped home care providers in, I took it, I guess it was good news, but I still feel we still have the same problems of caregivers that are going to need time off, that are going to be exposed. And I think that our caregivers nationally also they need these protections because they're the weak links in a lot of the exposure. So what I'm trying to process now, and I'm looking forward to getting the group's feedback on, is I guess what we need to use the payroll protection plan to kind of mirror some of the benefits in the Families First to support those caregivers. That's kind of where I'm at.
Okay. And Andrew, you want to just quickly summarize for the group the payroll protection plan and how you think that's going to work based on what you've studied?
So the way and looking at it, and again, it just came out like Friday, I think. It's just under 1,000 pages. And a lot of the information out there is based on summaries. So my sister-in-law is a partner in employment with Ogletree Deacons, and she's been, really trying to work through it and read it. And at a high level, if you can get 2.5 times your monthly payroll that you would be able to use to pay payroll and other expenses, rent and other recurring expenses, and that some of that will be forgiven if you spend it during this 8-week observation period on items to maintain your staff and keep the business going. And in speaking with other agency owners in the South Jersey market, everybody's viewing this a little bit differently. I've had some competitors even this week say that anyone that's working during the quarantine period is getting time and a half. I've had another competitor give an immediate $3 an hour price bump. And then we had Care One, which operates about 30 buildings in the New York, New Jersey market. They're giving $150 a week bonus to everyone that's working. And my sense is that this is being funded through the payroll protection plan.
Okay. Very interesting. Thanks, Andrew. Other questions or comments from anyone on the call that either responding to Andrew's research or other things that you have learned?
Yeah, this is Andy Howard with Home Care Professionals. Yeah, I'm very interested in the PPP program, and I've also been doing the research and weeding through the differing information that's been coming my way. I guess the big question I have about really the loan forgiveness aspect of it is, are they, and I don't expect anyone to know the answer, I'm just kind of throwing it out there as something that's weighing on my mind, is, are we looking at maintaining headcount or maintaining employee compensation? I'm sure all of you, like us, experience a lot of turnover. It's just inherent in what we do. It doesn't mean we're bad companies. It's just the nature of our business. So I'm curious how employee turnover is going to be viewed and new hires are going to be viewed. And also, it's interesting to hear some competitors giving, bonuses. I don't know that, I mean, maybe it will be, but I don't know how that's going to work in the forgiveness program. So I would just advise caution until we know exactly how that forgiveness is going to work, because you might be spending money that ultimately you might not be able to recoup once we know better how that loan program is going to work. Just my 2 cents there.
Great questions, Andy. Andrew, did you have any sense of Andy's question? And
yeah, and at a high, I do, and at a high level, and I looked at that as well, and what I'm seeing, and I still need more work, but they're looking at head count. So you could, an extreme example could be that, we can have 50% of our aides that have childcare issues and that we can hire to replace them. And if that gross number is the same, then we maintained our head count. And that's my interpretation as of right now.
Yeah, great. That's good to know. Thank you. I understand that's just your opinion, but I appreciate you sharing that opinion.
Sure.
Other questions or comments about any of the things that we've talked about today?
Yeah, this is Mark. I'm concerned about the unemployment, the federal unemployment benefit of $600 a week being a deterrent for people to seek a job, and I think it may end up. There's going to be a lot of people out of a job, and normally that would result in a better hiring situation. But if people can accept $600 a week without having a duty to accept work, I'm really concerned about that. I'm wondering if everybody else shares that, and if anybody has any ideas about approaching that.
Great question, Mark. Anyone else want to comment on that? I know several of our members have done the math like you and are very concerned about that, particularly if there's not an expectation that they need to go back to work to retain that benefit. Bob Roth just joined us. Hi, Bob.
Hey, Stephen, how are you? So, Mark, that's a great question. We've actually talked about that at the HCOA board. There's a lot of factors that are playing into this. So it's not only the $600 Fed unemployment payment per week, but it's also the regular unemployment on top of for 39 weeks. Combine that with the lump sum of $1,200 and then $500 per child. One of my board members calculated that to be in excess of $24 an hour that they would receive, commensurate to maybe receiving $15 an hour. So yeah, Mark, this could be very problematic. Some of us have been through a few recessions. This is my third as an operator in home care. And I will tell you that, this is something that really keeps a lot of agency owners up at night right now, because we're concerned that, like in 08, 09, there were a lot of caregivers that chose to stay at home to collect unemployment and collect some of those benefits, that we may be stuck with that same situation right now. So we also, to combine with that, we're also very concerned as it relates to our state's Medicaid. And I serve on our Medicaid board here in the state of Arizona. And as you probably know, for those that are Medicaid providers, the rates are really, really low. And we're having conversations with the state next week to really talk about hazard pay. And we're also talking about some other things that they could do to really help us keep the workforce working and keep them safe. PPE is obviously a discussion that you may have already had, and we continue to have. Testing is a real challenge for us. I shared with Stephen, and you guys may have talked about this earlier, while Cypress did not provide care to a person that I knew, I worked with several home care companies. I actually contacted 12, and only 2 were loosely interested. And really the only way we were able to make that work was it had to be a live-in, because we really couldn't take that caregiver and put that caregiver on someone else, knowing that that was a COVID positive client. And then, all live-in rules applied. There was hazard pay that we actually worked out with the client. And then on top of which, we also had to work with the client to do a 14-day quarantine of that caregiver, and they had to agree to pay for that. So, I mean, these are definitely different times. When we get the testing figured out, that quarantine of a caregiver and paying for that is not going to be necessary. But to your point, Mark, our pool of people is already fragile enough as it is. And we've got caregivers that are afraid to work. We have caregivers that, when you really take a look at the CARES Act and you really look at, I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. I think it's 12 things that individuals must self-certify to be able to qualify. And our caregivers can qualify for most of those, whether it be a family member being sick and they need to be home, whether it be taking care of kids because there's no school. There's a lot of things that fall into this. And I'm real excited that Stephen is doing this forum, because this is an opportunity for us to share and really learn from one another. But your point that you just raised, Mark, is one that really, I think all of us need to be concerned about. We're certainly going to learn more when we talk to our state's Medicaid is Access. When we talk to Access and we talk to the managed care organizations on how they're going to help us keep their members cared for. And you have to know that us as employers, it's our duty and our responsibility to provide a safe work environment for our employees. And by doing that, we need to be able to make sure they're properly, they have PPE and they're properly protected. But everyone that I've talked to, it's usually incumbent upon the client that is supposed to supply that. But in our case, clients really can't. So we're trying to all get PPE. And in our state's Medicaid, we're actually pushing to the managed care organization saying, you know what, these are your members. While they can't afford it, you need to step up and supply the PPE. So I know I made it clear as mud, if you would, but we're all learning. And I'm here to tell you that I am really scared for the same reasons you are. Like I said, one of my board members calculated it out to be about $24 an hour if you extrapolate it over, you know, a 12 week or even beyond that, that's how much money they're going to get, because they're going to get the $1,200, they're going to get $500 per kid, and they're going to get all that unemployment money.
Clarification here, maybe Bob or Mark. I think one of the things that might be a little bit of light at the end of the tunnel is the $600 is actually up to $600 versus a $600 amount. So it is going to be based upon payroll, is my understanding. Is that your understanding, or is it just going to be a blanket $600 per week? Any clarification there for that?
I believe it is up to 600. I think you're absolutely right, Mark.
That's going to make it a little bit better, because at least we won't be completely competing with unemployment for staff that, you know, they'll understand they'll actually will more than likely do better going to work.
The other thing we've heard, and again, it changes day to day, but what we were hearing from some of our members is that they were seeing a significant increase in applicants to their recruiting process, and they were seeing some high quality applicants, and they were able to be much more selective in the people that they hired. They're concerned about this online onboarding training process, but there's a sort of a ray of hope out there that there's going to be a lot more quality caregiver applicants available, and companies are going to have to refine and refocus their selection process. And so that will be an interesting part of this process going forward. What other observations or questions do you have about any of the things that we've talked about thus far? Kristen, let me tap you for a moment. What is the Home Care Association of Florida hearing, seeing, saying to your private duty members about some of these topics?
Well, one thing, if I may add one little wrinkle to the unemployment part of things, we confirmed this morning that independent contractors are going to be eligible to collect unemployment as well under the CARES Act, which really throws an interesting little wrench into it. We're waiting for further clarification on exactly how that's going to work, but we do know that they will be eligible. So that's going to change some things, particularly in Florida with our registry models. But of course, the other things that we're hearing from all of our members, just not just private duty, is the lack of PPE, what to do once they've gotten a COVID positive referral, if they're able to turn down referrals and what that's going to look like because of a lack of PPE. Our Department of Health reached out to us this morning. The state office of the Department of Health reached out this morning to say that they're working on a large number of home delivered meals, having access to home delivered meals, and asked us to reach out to our membership to see where there was the greatest need, because they may actually have access to get food to individuals, which is great. So at least we're getting some positive response from them, but you know, just like everywhere, it changes every minute.
Very good. Thanks, Kristen. Appreciate that update.
Hey, Stephen, just to pick up on what Kristen said, you know, there was a document I came across on the CARES Act, and it states at the very bottom when they list all the criteria, it says the CARES Act also expands coverage to include individuals who historically have not been ineligible, who have been ineligible for unemployment benefits, including individuals who are self-employed, gig workers, freelancers, independent contractors, and part-time workers. New hires who could not begin their employment are also covered, even if they do not have a sufficient work history to qualify under their normal state unemployment eligibility rules. So, Kristen, to your point, it really covers a huge swath of people, and independent contractors are one as well.
I'd like another clarification. One of my staff members has just said that if somebody says, you know, just because of the climate, I don't want to go to work because of it, so I'm going to self-quarantine, that does not qualify. Fear does not qualify as a condition to allow them to qualify for funds. That's a clarification. That's our understanding. Another thing, which I'm going to put some light, which I'm very happy to hear. I just found out from my office staff that our retention of our staff, caregivers, has never been as good as it is now. We've literally cut down. We normally lose quite a bit, and we only lost, for instance, in March and February, 20% of what our trending was. People, I believe it's because of the virus that there are people who are very serious, and they've actually stopped a lot of their job jumping. And I think that's going to work in favor, not only for us, but obviously for home care in general.
Interesting.
Very good. Thank you. Thank you, Marlon. Other thoughts, comments, questions about any of the topics that we've talked about today?
I'm just curious to know if anyone in the affected areas are seeing hazard pay to the direct care staff. Again, in the South Jersey market here, I had 3 competitors that were doing it already. And again, I'm just curious as how other agencies are responding to that.
And have they raised their rates to cover the quote hazard pay, Andrew?
Not to my knowledge. That's not the sense I had.
Okay.
So the couple experiences that I've had is they've done, Andrew, they've done both. They've raised the rates and raised the pay. So, you know, I talked to a friend of mine in Atlanta just yesterday, and he told me he picked up a case where he's paying the caregiver $20 an hour and he's billing out at $40 an hour. And in the example that I gave previously, there is hazard pay and they're upcharging for it as well. I think we're going to see more of that. And as I shared with you, that's kind of going to be our mantra that we go to our state's Medicaid and the MCOs, is that we have to pay hazard pay to these caregivers.
Well, and it will be interesting to watch that, to see at what point somebody starts crying price gouging and the state's attorney general start looking into that. I don't know what incremental increase trips over the line to make it price gouging. Obviously,
in New Jersey, it's 10%.
10%? Okay.
During a state of emergency.
Okay, so we could increase up to 10% without tripping over that line, and that's in the state of New Jersey. Thanks, Andrew. Appreciate that. Does anybody else have any insights or information on that as far as whether agencies are increasing their prices and increasing their pay, and what the implications of that are?
Well, in Rochester, I just instituted it's not as competitive here apparently as it is in New Jersey, but I just had we're calling it a compassion bonus to encourage people to stay till May 15th and put in a certain number of hours. But ours is only $100. I mean, frankly, it's really symbolic. It's a matter of acknowledging the work, and again, we're companion care only, so there's sort of a different nature to our work, but we still face some of the same reservations about helping people. But I really want to do it more recognition and making them feel good about the work that they're doing. And I really do think someone mentioned lower turnover. I don't think ours is lower, but I think there's a lot of people sticking around because of that connection they have with the clients. And I'm in my communications and everything, I'm constantly reminding everyone of, you know, how proud I am of the level of commitment, and reminding them of sort of a duty.
Yeah, that's a good idea.
The idea of sort of a retention bonus to me is appealing, because when you start changing people's hourly rate, I know sometimes it just might be the only way to go, but when you do that, it starts to feel like that's the rate they should always be paid.
Well, that's right. It's easy to raise it. It's hard to take it back to the normal rate.
No one likes to disgorge anything.
Yeah. Yeah.
Yeah. So this is.
I have to run, but thank you all. It's been helpful. It's good to see you, Stephen.
Thanks, Mark, for being with us, and we'll be on next Thursday at the same time. So join us then.
Thanks for doing it.
Thank you.
Hey, Stephen, this is Don from Home Care Professionals.
Yeah, Don, go ahead.
So in the Bay Area, I mean, is one of the epicenters in the U.S. I mean, we've had, you know, a huge influx of potential clients recently with the virus. And so there's only a few of our competitors here, which there's probably 500 companies alone in the Bay Area. But I'd love to understand what everybody else is doing if they are taking on COVID clients, you know, what that looks like as far as, you know, their rates, the pays, which we just sort of touched on. But I'd like to understand, are you guys extending hours? And also, most importantly, what are you doing about PPE? I mean, here in the Bay, it is nearly impossible to get any equipment at all. So, I mean, for the last 3 weeks, I would say half of my day is trying to find equipment, you know, whether that be here in the US or abroad. So I just like to know, is anybody currently accepting clients right now?
And anybody in the room accepting clients that are positive?
You know, our standard response is we take them on a case-by-case basis.
Yeah.
You know, and I think at this point in time, you know, we have not been able to find a caregiver to take on a client.
Yeah.
But,
we have one member, when we talked about it the other day, said, yeah, absolutely, we will take COVID positive clients. We've been doing this for years. We've dealt with HIV clients. We've dealt with SARS. We've dealt with other infectious diseases. We have the policies, the procedures, the protocols. We have some equipment. As long as we're still able to have the personal protective equipment and operate under the policies, we'll continue to do that. That's the only one that I know of our members that has, in fact, cared for COVID positive cases. Others are, as you said, Bob, a case-by-case basis, or some have said, no, we're not prepared and equipped to do that. Others have said, yes, we will. Our intention is we have a policy in place, then it's a matter of can we get the equipment and protection.
Okay. The second question I'd love to ask the group, which is kind of away from what we've been discussing, but I'd like to understand what people are doing as far as business development, reaching out to their referral sources, also, you know, the inside sales, reaching out to prospects, whether you're doing, you know, pay per leads or what it may be. I'd like to understand what people are doing for that. And then also, has anybody had experience of sending information to referral sources to make it easy for them to make referrals, since we are not allowed in, you know, in our accounts as of right now via, you know, online, you know, something they could fill out, you know, with a referral, etc. So what is everybody doing as far as sales is concerned?
Who can respond to Don's question? What are you doing with regard to sales and marketing?
I can respond. This is Julie Taylor from Michigan. We actually are calling all of our partner referral sources, and that being the other home care skilled agencies, as well as we work a lot with agencies that do placement into facilities. We're calling each and every one of those personally and telling them that we are still out there working. We are taking new cases. We are taking priority 1 cases first, and that we will look at everything that they have for us on an individual case-by-case basis. That's been really good because all of these people are also working remotely from home. And, you know, it's amazing because I can talk to people, you know, and our other people on the line, you know, they want to talk to people too. So I can get a better understanding of what's going on out there by being able to connect with them. The other thing we're doing also is sending emails to let them know and remind them that we are taking on a case-by-case basis, and to please, if there is someone that needs help, let us know.
I have a comment to make, and it's kind of funny here. Maybe I'm a little OCD here, but we've been doing some you know, seeing different videos about the importance of not touching your face. And so I happened to be here with some of my staff members here, and all of a sudden we started watching all of our wonderful owners here. And we kind of got this funny feeling because we're watching each one kind of, which is everyone. I caught myself first doing it.
And us.
And every picture we have here, we are a whole bunch of guilty people. So it's really, really hard. And my understanding, just for when you go back to your staff, that the #1 reason for a mask is not for coughing, it's to prevent you from touching your face. And so in any case, I was totally distracted with what was being said because I didn't realize how much we actually do that. and most of us were pretty good at it. So anyway, that's a comment.
Thanks, Marlon. Other questions, comments about the sales and marketing approach? How many are actively out there contacting your referral sources, and what response are you getting?
Well, this is Matt from Orlando, and we are even before COVID became a thing, it was difficult to walk in and see or make an appointment and see a referral source. So this has just, made it worse. And we just concentrated on being on the phone and calling people on the phone, sending handwritten note cards. I mean, it's kind of old fashioned. Everybody gets so many emails now. I don't know about you all, but it seems like every third or fourth email I get is some webinar that I need to go to, and I've never done so many webinars in the past 2 weeks as I have these past 2 weeks. So anyway, just being in contact with them on the phone and just trying to be available for people.
Okay, good. Thanks, Matt. Other comments?
Let's just put Andrew with Home to Stay, and our phones have been quiet since the quarantine started, and working on an inside sales initiative. We didn't really have much of one before, so starting that now. But related to PPE, one of the things I'm looking at is safety glasses in addition to the masks, because that would offer eye protection. So if anyone has any local industrial supply houses in their market, think about reaching out for safety glasses, because I think, that's also a route of infection. So if you have a mask, gloves, and safety glasses, I think that's a pretty good start. You can expect to pay about $3 to $4 for a pair, but they are reusable. And the other thing too is it's just a way of supporting the caregivers, that we're doing something in light of this shortage.
Andrew, you all, I know, have a real emphasis on caring for patients with Alzheimer's and dementia. What are you seeing in that arena as it relates to dealing with coronavirus?
Right now, I think like a lot of people, with the lockdown going on, but I have very strong concerns about, our residents that are in buildings, even though we have aides going in there, being locked away from their families. Very big concerns about what's happening. One of the things that we're starting next week is a virtual support group for our All's Better clients. So just a way to stay connected with families, and a forum like this via Zoom for them to connect and have like a virtual support group. But really, Stephen, it's we're really early, and still people are still trying to figure this out.
Interesting concept, Andrew, and others may want to think about that. Using this platform of Zoom, it would be relatively easy to put together a support group of primary family caregivers to come together and give them an opportunity to share their feelings and thoughts and ideas with other family caregivers.
Yeah.
Good. Thank you. Thank you. Great idea. Great idea. I'm going to just deviate from our conversation just a bit and jump across the pond to England and ask Neil Eastwood to give us a comment on what he's heard and what he sees happening in England and how that's similar to or different than what's happening in America. Neil?
Yeah, thanks, Stephen. This is a fascinating insight, I must say, and very, very similar. I mean, examples include the government here delivered 300 masks to each home care provider. And I spoke to one today and he said, that's all very well, but we had 260 visits today. So there's a desperate shortage. I think that's the same. What we've seen from the survey that just came in is about a 10 to 20% loss of staff, primarily due to self-isolation, but also some shielding, self-shielding, and some childcare issues. And that's meant a third of the provider network here are reporting urgent and immediate staffing needs. So although there are some, I think 39% need more staff and 17% have too many staff, perhaps because clients are in companionship, particularly, and it was mentioned earlier, they are withdrawing and being, going back into the family, if you like. And so that's meant some home care operators have seen a decline in hours. But in the UK, about half of our client base is private client work, and therefore perhaps not in many cases as medically urgent. And so that's probably suffering a little bit more. But it's a real, moving feast. We've had here the government announced, and it's very interesting to hear the discussion about the impact of what seemed to be quite perhaps not thought through, heavy-handed, simplistic government policies that have strange impacts on the hourly workforce. Here, providers were reporting an increase in those people who are newly unemployed. And then the government announced suddenly, in what it felt like was a hurry, that they would cover 80% of the wages of furloughed employees. Suddenly that dropped again when everyone decided that staying at home was a rather appealing option. And we don't yet know from these job seekers, we don't know their commitment, we don't know how long they'll stay. And of course, there's a resistance to hiring newbies because providers are saying, I'd rather have someone who's all ready to go, pre-trained, ready to hit the road. Well, of course, you're only then stealing from each other. So there's a whole lot of stuff going on here that sounds very analogous to the experiences that you've been sharing.
Very good. Well, thank you, Neil. Appreciate your insights, and we'll look forward to seeing the results of your research, and we'll share that over here through our outlets to folks in America. Thank you for being here, and thanks for sharing your research. What other questions, comments, observations do you have about any of the things that we've talked about this afternoon? Well, we're coming just past the top of the hour, and I want to respect your time. For some of you, it's the end of your day. And so we will plan to be here again next Thursday at 4 p.m. Eastern Time. We welcome you to join us. If there are others that you know of who might benefit, feel free to pass on the registration link. And think about what topics you would like us to be discussing. And if you would, send me an email, Stephen, S-T-E-P-H-E-N, @leadinghomecare.com, and let us know your questions or topics for discussion. If you would, you could copy Jill, Jill Scott, Jill@leadinghomecare.com, and we will pull together the questions and the topics and put together an agenda for our time next week. Jill, any comments you have or anything else we need from the group?
I don't think so. I did record, so we'll upload it and then send out the link to everybody that registered. So if you need to listen back, or if that would help you to think of other questions, or you didn't catch a detail, then you can listen to that. So
good point. What we're going to do is we created a blog post to announce this office hours, and we're going to add to that and make it a rolling post. So I will put on some notes from this session, and we'll put a link to the video, and then we'll put the introduction for the next week's time and the topic for discussion, and we'll send that out to everybody again. So that'll sort of be a rolling record of what we're doing and a link to the video. So you'll have access to that. Well, thank you all for—
Andrew, did you have something?
Yeah, I want to be sensitive, Stephen and Jill, not to hijack your meeting here, but there was another webinar that I attended a couple weeks ago, and there's another one tomorrow at in another, that a state association is holding that has been dealing with this for a lot longer than we have here. And I found that very helpful. And Stephen, I'm happy to email you that, so if you could choose, if you wanted to share it with your group.
That'd be great, Andrew. Thank you very much. And if you have any other resources that you're looking at or using that you think would benefit this group, feel free to send us an email. We'll add that to the blog post as well. Thank you very much. Appreciate it.
Sure. Take
Thanks,
care,
everybody, for being here. Have a great evening, safe weekend, and we'll talk to you next week, same time, same station. Bye now.
Thank you very much.
Thank you. Bye-bye.
Thank you.